Hello, this is Trilok. I'm a dietitian. Today, let's talk about high blood pressure or hypertension, a condition that affects nearly 35% of adult Indians. It is often called a silent killer because it significantly increases the risk of heart attacks, strokes, and kidney disease. In today's video, we will talk about both the problem and the solution. But before we begin, let's first understand what exactly is blood pressure. When your heart pumps blood into the arteries, the force of blood pushing against your artery walls is called systolic pressure, usually around 120 millimeters of mercury in a healthy adult. This causes the arteries to expand slightly due to their elasticity. When the heart relaxes between two beats, the pressure inside the arteries falls. This lower pressure is called diastolic pressure, usually around 80 millimeters of mercury. These two numbers together tells us how hard the heart and blood vessels are working. But in hypertension, this force is consistently too high. Over decades of uncontrolled hypertension, the heart muscle becomes thick, a condition called left ventricular hypertrophy. This thickened muscle becomes stiff, so the heart fills poorly with blood, leading to diastolic dysfunction. And hypertension also damages the coronary arteries. All of this increases the risk of heart attacks. Normally, when we exercise or run, heart rate naturally increases. The heart pumps more blood and healthy arteries expand or dilate to accommodate this extra flow. Because of this flexibility, blood pressure rises only slightly. This is a normal healthy response. But in hypertension, blood pressure is already high at rest and it can rise further during any activity or stress. This happens because of four major internal changes. Arterial stiffness is the largest contributor, about 40 to 45%. The second major factor is fluid retention due to altered salt handling, about 25 to 30%. Insulin resistance and excess visceral fat contribute roughly 15 to 20%. And chronic stress with elevated cortisol accounts for about 10 to 15%. Arterial stiffness or loss of elasticity starts at the level of the artery wall. An artery has three layers: an inner endothelial layer, a middle smooth muscle layer, and an outer supportive layer. The ability of an artery to dilate and remain flexible depends on the health of all three layers. For example, the inner endothelial layer releases a gas called nitric oxide, which helps the artery dilate when needed. The hardening of arteries usually begins with damage to this endothelial layer. This damage is caused by chronic inflammation. Inflammation is actually a repair process, like repairing a road. Once in a while, repairs are necessary and helpful. But when repair work goes on all the time, it starts causing more damage than benefit. In us, chronic inflammation is caused due to factors such as high blood glucose levels, as seen in diabetes, high homocysteine levels from vitamin B12, B9, or B6 deficiency, smoking, environmental pollution, and other metabolic stressors. Once the endothelial lining is damaged, it becomes more permeable or leaky. This allows substances such as cholesterol and calcium that circulate in the blood to seep into the middle layer of the artery. Over the years and decades, this leads to plaque formation, calcium deposition, and progressive hardening of the artery wall. Wherever sodium is, water goes there. So when we eat foods high in salt, we retain more fluid, which increases total blood volume, leading to higher blood pressure. Abdominal obesity and fatty liver lead to insulin resistance, which increases salt reabsorption in the kidneys and promotes inflammation and endothelial dysfunction. In addition to this metabolic effect, excess visceral fat also physically surrounds and squeezes the kidneys, impairing their ability to excrete salt and water properly. Both these mechanisms increase blood volume and raise blood pressure. That's why even a 5 to 10% reduction in body weight can lead to meaningful blood pressure reduction. Psychological stress, poor sleep, and anxiety increase cortisol and adrenaline levels. These hormones cause vasoconstriction, tightening of the blood vessels, which raises heart rate and blood pressure. So, high blood pressure isn't caused by just one factor. It is mainly due to stiff arteries, excess fluid, metabolic inflammation, and chronic stress acting together. And the main factors that lead to these changes in the body are unhealthy high sodium diets, physical inactivity, overweight and obesity, excess alcohol intake, smoking, anxiety, stress, and poor sleep. Now that we understand why blood pressure rises and what causes it, the next question is, what can we do about it? Let's look at the dietary and lifestyle changes that truly make a difference. Avoid ultra processed foods and fried foods, which worsen arterial stiffness and blood pressure. Keep blood sugars under control. This can be achieved through weight loss, taking medications as prescribed, and eating the right foods. If you want more practical guidance, you can check out my videos on diabetes, where I explain this in detail. Calcium is meant to be deposited in the bones, but when magnesium intake is low, some calcium can get deposited in soft tissues, including arteries, contributing to arterial stiffness. Just one or two magnesium rich foods daily, mentioned here, such as seeds, nuts, leafy greens, or millets, can make a meaningful difference to blood pressure and arterial health. An anti inflammatory diet is not about one superfood. It is about eating more natural, colorful, fiber rich foods and avoiding processed foods consistently. Omega 3 fatty acids reduce arterial inflammation, improve arterial elasticity, and are known to reduce arterial stiffness over time. Fruits, vegetables, whole grains, nuts, and seeds are also excellent sources of dietary fiber, which support both metabolic and vascular health. Include probiotic foods such as curd, homemade fermented vegetables, or kanji. A probiotic supplement can also help. The safe limit is about 1 teaspoon of salt per day in total. This includes all sources of salt: salt used in cooking, salt added at the table, salt hidden in foods like snacks, bread, pickles, sauces, and packaged foods. Most people consume 2 to 3 times this amount without realizing it. Potassium counteracts sodium's effect. It helps relax blood vessels and supports kidneys' ability to excrete sodium. That's why higher potassium plus lower salt intake is one of the most effective dietary strategies for blood pressure control. Here is a list of vegetables, fruits, and pulses, which are some of the best natural sources of potassium. You may have seen low sodium salts in supermarkets. Regular table salt is sodium chloride. Low sodium salts usually contain 60 to 70% sodium chloride and 30 to 40% potassium chloride. So you get less sodium and more potassium per pinch. Large studies have shown that replacing regular salt with potassium enriched salt can reduce blood pressure and cardiovascular events in the general population. People with kidney disease, please consult your doctor before making any changes to sodium or potassium intake, because high potassium foods and salts may need restriction. It is also useful to monitor homocysteine levels. Elevated homocysteine is often related to low levels of vitamin B12, B9, or B6. If deficiencies are found, supplementation should be done under medical guidance. Lifestyle and behavioral factors. Avoid repeated blood pressure spikes, such as excess caffeine, mental stress, very high intensity, unaccustomed exercise. Regular, moderate intensity aerobic and resistance exercise is the key, not extreme workouts. Consistency matters more than intensity. Reducing insulin resistance and visceral fat by losing weight and reversing fatty liver plays a major role in improving blood pressure. And finally, prioritize good sleep and mental health, because poor sleep and chronic stress can keep blood pressure elevated. For practical strategies, you can watch my videos on nutrition and mental health, like stress and anxiety. Often overlooked but very important contributors to vascular damage are smoking and air pollution. So, limit or avoid smoking and reduce your exposure to air pollution. You might say, I'm avoiding salt, I exercise regularly, or I'm at normal weight. But blood pressure doesn't improve by fixing just one habit. It improves when you work on nutrition, lifestyle, environment, metabolic health, and mental health together. We know that hypertension is the second leading cause of chronic kidney disease after diabetes and a major risk factor for heart attack and stroke. By making simple, consistent diet and lifestyle changes and working with your doctor, you substantially lower your risk of these complications. So, start making simple changes today and feel free to post your questions in the comments. I hope this video was helpful. Thank you for watching Nutritional Perspective. I'll see you in the next video.